I'm fortunate that as a joint replacement surgeon, that knee replacement turns out some of the happiest patients in the country. It's the most economically supportable surgery in terms of quality of life, return to work, however you want to measure it. When the patient's post-op, you'd be surprised how much they're thinking of the incision and the wound and the scar that they got.
I'm sure vanity will play some part of that, but scars can be uncomfortable as well. Not only are they not attractive, they can be very uncomfortable and painful.
You'd be surprised how many of them want to know how it's going to be closed, want to know when they can shower. They've seen their friends with staples. They've heard horror stories about staple removal. It's just the wound closure, right? It's what the patient sees every day. And when they can look at their knee and they show other people who are perhaps afraid of knee replacement, and you see this beautiful little scar and they say what their experience was, that's a compelling story.
So having a nice clean scar is definitely a benefit, not only from appearance, but from comfort as well.
That sense that they feel more normal quicker after the surgery, I think helps the mindset of the joint replacement patients see themselves as getting better. Their incisions are exposed, they're beautiful little straight lines, and they're seeing the progress. They're bending and straightening their incision that they can look at.
You can see it without having to take the bandages off and see that it looks good.
And so, whereas it may seem like a secondary afterthought to the surgeon, it's really what the patient sees every day as the result of their knee replacement. And so I think that sense gives them a feeling of this is going to be okay, and it helps their progress as they make that next step to where they're going from the hospital.
I'm looking forward to being able to walk and ride bikes and just lead a normal life, and yes, that's amazing to me.